families and communities like Brampton. I'd like to thank Minister Tabolo, Minister Elliott, for your tireless commitment to improving mental health access, outcomes, and for the work that went into making today possible. And Minister Bethenfalvy and Phillips for delivering on our government's commitment to protecting people's health. With this announcement, lives will be changed for the better and our community made stronger as a result. And to our local CMHA, Peel, Dufferin partners, thank you for the remarkable work that you continue to do for Brampton, for Peel, and your dedication to the long-term mental health of our community. Thank you very much, and I'll now like to pass it over to Minister Bethenfalvy.
Good morning, and thank you, Brad, for that welcoming introduction here in Brampton. And thank you, Minister Phillips and Elliott and Tabolo for joining us, as well as MPP Sandhu, where in your backyard as well. And a heartfelt thank you to CMHA Ontario and CMHA Peel Dufferin for hosting us today. Incredible work to support the mental illness of so many individuals. Since the beginning of the pandemic, we've seen how significant the impacts have been on the mental health of Ontarians across the province, including our frontline healthcare heroes who continue to make very real and personal sacrifices to keep our communities safe. Our government's top priority has always been to protect the health and safety of every person in this province, and that includes mental health. The investment we are announcing today is protecting our progress by expanding and building on the up to $194 million in emergency funding for mental health and addiction services that our government invested very early in our pandemic. The investment is also building on the $23.6 million to expand access to internet-based cognitive behavioral therapy, which has been accessed by nearly 3,000 people. This is an extraordinary amount of support for our citizens in this province, including giving behavioral therapy that has been accessed by nearly 70,000 Ontarians since the province was launched during the COVID-19 pandemic, including nearly 10,000 healthcare workers. So with that, I'd like to now call upon Minister Elliott to come on up and say a few words on behalf of our Government of Ontario. Thank you very much.
Well, thank you very much, Minister Bethenfalvy, and good morning, everyone. It truly is a pleasure to be joining all of you here in Brampton today. Thank you, Camille. Here, thank you very much, the CEO of CMHA Ontario and the Canadian Mental Health Association's Ontario Division for welcoming us. Every day, the incredible staff, volunteers, and leadership team at CMHA Ontario go above and beyond to provide high-quality mental health services to Ontarians needing help. Whether you live in Peel, Leeds Grenville, Niagara, Thunder Bay, or any of the other CMHA Ontario locations, we are grateful for their incredible dedication to providing individuals in need with support. Their efforts have made such a difference for Ontarians throughout the pandemic, of course, and beyond. Throughout the COVID-19 pandemic, Ontario's healthcare workers have been unwavering in their dedication to protecting the health and safety of Ontarians. In our darkest hour, they were there for us, demonstrating bravery and resilience, often putting themselves in harm's way to care for the sick and vulnerable members of our communities. But while Ontario's cautious approach is working, for our frontline healthcare workers, this tireless work continues each and every day. And just as our healthcare partners are there for us, so we must be there for them as well. That's why I am so pleased to share that our government is investing $12.4 million to provide much needed support to our frontline mental health care workers. This funding will ensure continued access to existing and expanded mental health supports for all of Ontario's healthcare workers, whether in acute care, long-term care, home and community care, or in other locations. This includes self-referral and intake services, employer and employee resources, weekly online peer discussion groups, and access to confidential support from a clinician, including one-to-one psychotherapy. A COVID-19 psychological support program will provide increased access to clinical psychologists specializing in trauma, mood, and anxiety disorders, and other psychological conditions. And workplace mental health training for leadership, management, frontline healthcare workers, and non-clinical staff will provide workplaces with the tools to foster mental wellness. Together with our investments to bolster our healthcare workforce, these investments will ensure that we can continue to provide tailored supports to help Ontario's physicians, nurses, pharmacists, respiratory therapists, personal support workers, and all of our healthcare workers experiencing mental health challenges. Because as we all know, mental health is health. So thank you again to the province's healthcare workers for everything that you do to provide exceptional care each and every day. And with that, I will now hand it over to my friend and colleague, Minister Rod Phillips.
Thank you so much, Minister Elliott, and thank you, Camille, for welcoming us here today. The $12.4 million that is being provided for all healthcare workers will be very, very much needed and useful for the 100,000 frontline heroes that work in the long-term care sector. We all know the challenges that have been faced in the long-term care sector, and our frontline heroes deserve this support, as do the rest of our healthcare workers, and that's why I'm so pleased to be here in Brampton with my colleagues today for this announcement. We have a plan to fix long-term care, and that plan has three components. The first component is making sure that we have modern, safe beds, new beds, 30,000 of them, for our precious seniors. And just here in Brampton alone, we have 680 new beds and over 120 reconditioned beds, including at Faith Manor, where I visited recently with Minister Sarkaria and MPP Sandhu and Mayor Brown. That compares to 0 beds that were built in the 7 years before we came into government, when the previous government built just 611 beds in the entire province. So 680 beds, part of our 30,000 bed commitment, something that Minister Bethlenfalvy reinforced in the Fall Economic Statement last week. We also have our plan to make sure that there's accountability, enforcement, and transparency in our long-term care homes. And that's why we've announced the doubling of the number of inspectors, so Ontario will have the best ratio of inspectors to homes, and a number of other accountability measures to ensure that everyone can trust what's happening in our long-term care sector and feel safe and feel their loved ones are safe. But today's announcement deals with the last priority, the third priority, around staffing and care. So important that we deliver the level of staffing that is critical to make sure that our seniors, our residents, get the care that they need, and that's why the historic commitment of 4 hours of care, adding now over 27,000 new staff. And those staff, of course, to care for our elders, need support. And that's exactly what today's announcement does. It provides support, mental health supports that can be so vital for them as they provide the support for our loved ones and the residents of long-term care homes. So again, I'm pleased to be here today in Brampton, pleased to reach out and thank not just the frontline healthcare workers, but the frontline mental health workers who've been so vital to what we've done today. And with that, I'm pleased to turn it over to my colleague, our Minister of Mental Health, Michael Tibolo, who's been leading our charge on mental health. And I have to say, from a long-term care perspective, if I can just comment personally, he's been fundamental to some of the changes we're making, ensuring that qualifications like clinical social workers who can provide ongoing mental health support in our homes are going to be part of those additional 27,000 staff that we're adding to support our residents and to support our long-term care homes. So with that, I'll turn it over to Michael Tabolo.
Thank you, Minister, and good morning, everyone. It is truly a pleasure to be here this morning to speak about this great announcement. You know, as the Minister responsible for mental health and addictions, one of the things that I am very grateful for is the attention that the Premier and my colleagues in Cabinet and Caucus have given to ensuring that we build a system that is connected, that has access, and looks after everyone that needs help when and where they need it. As Minister Elliott said, that mental health is health. And of course, when you think of the people that are providing the supports and services in the province of Ontario to Ontarians, we can't forget that they themselves are human beings, that they themselves are exposed to very difficult circumstances, especially during COVID-19 and the repercussions that it's had on their lives. It's great to be at CMHA here in Peel. I've visited many of the CMHA locations, 28 of them throughout the province, and have an excellent relationship with Camille, the CEO of KMH Ontario, the CMHA Ontario, the work that's done by CMHA, which is critical to the well-being of the people in the province of Ontario. So this partnership today is another example of a collaboration that will make a difference, a positive difference, not just to the people that CMHA serves, but also to the people that are providing those services. And I have to say our government has taken mental health and addictions very seriously. You know, the commitment of $3.8 billion, the investment now of $525 million annually, over $500 million, to ensure that people's mental health is being taken care of. And those that are suffering from addictions also get the supports they need where and when they need them, so that we can tackle some of the difficult situations that we have in our society. We will continue working diligently to ensure that we continue building a system that works through the Roadmap to Wellness and providing supports that are culturally sensitive to the people in the province. And that means building step care models where we cannot have all the services delivered, looking at the lifespan and ensuring that we're providing the appropriate services to the age group that we're looking to serve. And these are all very, very important things that we have to do because of the importance that it will have in the overall health of the people in the province. You know, we talk about economic recovery, but we know that we cannot have a recovery if our people are not healthy. We know the statistics tell us that we need to do more with respect to ensuring people are healthy going to work every day. That includes their mental health, and that's why these investments are so important, not only with respect to helping people in Ontario, but also the people that are serving and helping the people in the province. And our government continues to be very, very concerned about mental health and ensuring that those supports are there. And that means providing the supports necessary for people that are looking after our frontline healthcare workers and ensuring that they have the supports that they need as well. And I hope that we will continue doing more work, and I want to express my sincere gratitude to all the frontline workers, all the healthcare workers that are doing yeoman's work in keeping the people in this province safe. With that, I'd like to hand it over to a very good friend of mine and someone who has the health of the people of this province in her heart, Camille Quenneville.
Thank you so much, Minister. I'm really delighted to be here and to welcome all of you to Brampton and to CMHA Peel Dufferin. I'd like to acknowledge my colleague David Smith and thank him for hosting us here today. It's not every day you have almost half the provincial cabinet show up at your door. We're really delighted to see you. I think it speaks to how important you feel this issue is and your support for it. We've all witnessed over the last 19 months how difficult the pandemic has been on all of us, but most particularly on our healthcare colleagues. And I mean healthcare in the broadest sense. Clearly, we've seen what's happened in hospitals, the impact it's had on nurses. We've witnessed what's happened in long-term care homes, but often forgotten is home and community care. I was delighted to hear the Minister talk about that today. my colleagues in community who support the mental health and addictions needs of all Ontarians. I've been witness to their extraordinary efforts over these past many months. And we know that they have really worked hard and struggled. And on call after call with my sector colleagues, we've been talking about this. And my colleagues at the Canadian Mental Health Association have felt for some time that we might be able to be part of the solution. So our Mental Health Works program, which is a workplace-based program that looks after the psychological safety impact of having good workplaces, is something that we turn to see how could we modify that to make sure it's appropriate in healthcare settings in particular. So we hired a nurse and we've had her redesign the curriculum so that we're in a position to be able to go out and meet with our colleagues in various sectors across healthcare, give them the support and service that they need so that they can continue their important work, that they will stay in their jobs, that they will feel supported as they well should, and that they will feel that we care and that truly we want to be able to give them the service that they need so that they can continue to do their great work. We took this idea to Minister Phillips and Minister Tobolo and Minister Elliott, and the result is why we're here today. They too agreed that this was worthwhile and very valuable and important work, and we couldn't be more gratified and we couldn't be more proud to be part of this, to be able to support our colleagues across Ontario, and to be able to be part of the solution as we move forward through COVID. So I want to express again my deep gratitude for the funds today for this important program. Again, to my colleague David Smith and my colleagues across Ontario, not only through CMHA, but in community-based mental health and addictions care broadly. And to say once again, thank you to all of these fine ministers for their support today.
Great, thank you everyone. We'll now go to questions. First is Jamie from City TV.
Mr. Tobolo.
Well, I think at this point in time, my understanding is that it's being looked into, it's being investigated. So I don't think it's appropriate to make any comments. Well, again, there's circumstances relating to the situation that transpired that I'm not completely up to speed on, so I'm waiting to hear back. I mean, at the end of the day, the pet is a part of the individual's family. The reason that the pet was being kept was pursuant to a description that wasn't accurate, and it was released as a result of that. And so from the standpoint of what was right to do, what was done was the right thing to do. The situation that arose, as I said, is under investigation, and we'll wait and see what's finally determined as to how it transpired or how it happened.
That's right. Minister Elliott.
City News has learned that people are counterfeiting the old vaccine certificates to interrupt arcades and leaf games as well as other businesses. We know that the newer QR code cannot be counterfeited. COVID cases are on the rise. Will the provincial government finally commit to phasing out the old dated certificate system, which anyone can counterfeit?
Well, we're still using that system. It's going to take some time before we're able to switch over. However, the counterfeiting is, we're obviously dealing with that and investigating wherever we understand that this is happening. But we want to make sure that people do have the appropriate ID, whether it's the vaccine certificate or the QR code, to enter places where these are required. We know that the numbers have gone up somewhat. We anticipated that that would happen. Dr. Moore anticipated that would happen. And so what we're seeing right now are largely regional outbreaks, which we're going to be dealing with regionally. So we're taking steps and we're monitoring it each and every day.
Thank you. Next question is from Morgan at Global.
The question that I have is for Minister Elliott. Minister, I'm not sure if today you had a chance to read Dr. Peter Juni's comments about the honeymoon of the fourth wave being over. My question to you is, does the rising number in cases mean that the province's recovery plan is going to have to take a bit of a slower pace, meaning that we will not see all restrictions removed by March? And is it possible more health measures like vaccine passports and masking will have to be kept longer to help protect the long-term health of the province?
Well, we are seeing that we are moving forward. The last thing that we want to do is move backwards and go into a further lockdown. That's what we don't want. That the people of Ontario don't want that. That being said, the plan that we have put in place has been tested and considered many different ways. Dr. Moore, our Chief Medical Officer of Health, still feels very strongly that the system is ready to deal with some increases in cases. We knew that. As the weather turns colder, as more and more people are indoors, and we are seeing some regional variations where we are seeing some increased cases. There has been one in Sudbury, for example, which I'm sure you're familiar with. They are taking a local approach there, as we intend to do with the rest of the province. So we're going to stay the course at this point, but of course we're looking at the situation every day.
Right, and Minister, just building on that, with the colder weather coming, could we see potentially more restrictions put in place as the numbers are, starting to go up?
It is potentially possible, but we do know that there are going to be increases in cases as the weather turns colder, and that has been brought into the equation when we figured out the plan in the first place. So we're going to continue to look at it, Dr. Moore and his office are looking at it every day, as are we in the Ministry of Health, but we are not changing course at this point.
Thank you.
Hi, Minister, not yet. I have a question for you as well. So when you're talking about regional restrictions, I'm wondering who ultimately is going to be the one imposing those, if there are any new restrictions. We're still probably a far ways off from that. Is it going to be up to the local medical officers of health, or is it going to be the province making those decisions on what restrictions are needed for what region?
Well, it's primarily up to the local medical officers of health because they know their areas very well and they know where the breakouts may be happening and they know what steps need to be taken. But the steps are always taken in consultation with Dr. Moore and his team. We really see this as one team working together, but it's the local medical officers of health that know the situation on the ground in their own particular area. They give valuable input and recommendations to Dr. Moore as well.
You had said that the province had anticipated this, that Dr. Moore knew that something like this was coming. I mean, we're not talking about a huge spike. We're talking, it looks like a bit of a bump as of right now. What else are you anticipating? How bad could it potentially get in the next few weeks or months? What has the internal data told you and Dr. Moore?
We're not really looking at any specific endpoint where if we get to a certain number of cases or a certain R number or number of cases per 100,000. What we're really looking at it is in its totality. One of the important features to remember is that even though we are seeing an increase in the number of cases, because so many people are doubly vaccinated now, we're still not seeing huge numbers of people in our intensive care units. We don't want to be overwhelmed again, but I think that shows the value of the double vaccination. You can still contract COVID, but chances are you won't be hospitalized, and even if you are hospitalized, you won't end up in an intensive care unit. It will save your life.
Just one last question from Jamie.
I'm getting my steps in.
Okay. Yes.
Sir, Minister, this comes in from Miranda from the CBC. She's texted me a question. She's concerned about death threats that healthcare workers are doing because of the implementation of mandatory vaccines to be in a hospital. CEOs are being threatened, and there's another case about cohorts being threatened as a result of these mandatory first of all, your thoughts on that and the process of shouldn't this responsibility be yours so that the people in the front lines don't have to deal with these death threats and the implementation of mandatory vaccines? And what do you say to these people that are getting through?
Well, it's absolutely wrong. Our frontline healthcare workers have done so much for all of us over the past 20 months. The last thing they need is to receive threats for the incredible work that they're doing. And so we have laws that protect people in cases where that they feel threatened or that they're not in safety. So we have certainly, our legal officers are able to help us, our police officers are able to help. If anybody feels personally threatened, they can certainly report that to the police and they will receive the assistance that they need. But I would ask people to please, please don't do that. Just don't threaten people just because they're requiring mandatory vaccinations. That is open to every hospital to make that determination. Some, especially pediatric hospitals, have done that because their patients simply can't be vaccinated yet. We hope that will change with the introductions of vaccinations for children aged 5 to 11 in a month or so, but we're not there yet. So I think everybody needs to continue to take this very seriously, as we do. It is not all right to threaten somebody with respect to this, and we do have our law enforcement officers ready to proceed if necessary. Thank you.
Thank you. That's all for questions.
Thanks, everyone.